All right, good afternoon, everyone. My name is Melinda Garcia. I am the Public Health Program Coordinator at the Partnership for Maternal and Child Health of Northern New Jersey.
And good afternoon, everyone. My name is Kendra Julian, and I am the Adolescent Immunization Specialist at the Partnership for Maternal and Child Health.
Okay, and today we are going to do our webinar on what parents should know about adolescent vaccines. So some of the adolescent vaccines that we will be covering today are HPV, meningococcal B, meningococcal disease, Tdap, as well as the flu. And before we actually start the presentation, I would just like to kindly ask that everyone close any browsers that you may have in the background so that it doesn't interfere with the presentation. And again, thank you to everyone who is on the webinar today. All right, so let's get started. So first we are going to talk about HPV. So a lot of parents probably have heard HPV through several avenues, for example, maybe billboards, commercials, or just through family friends or anything like that, right? HPV is a very important topic to talk about because it does cause cancer, right? And HPV, firstly, is the most common sexually transmitted infection. It stands for human papillomavirus. So again, it is the most common sexually transmitted infection, and about 90% of the population is going to be exposed at some point. So again, most sexually active people will get HPV at some time in their lives. HPV is transmitted through any sexual contact or any kind of unprotected sex. So this includes vaginal, oral, and or anal. So if your adolescent or any adolescent is having any type of sexual contact, it means that it doesn't have to have any penetration per se, but any type of sexual contact without a condom can definitely increase the risk of contracting HPV through any of these ways, vaginal, oral, or anal. So as I mentioned in the first slide, HPV causes cancer, right? The most common HPV-related cancer in women is cervical cancer. But apart from cervical cancer, HPV can also cause vaginal, vulvar, anal, and mouth and throat cancer. Mouth and throat cancer is also known as oropharyngeal cancer. The most common cancer in men is mouth and throat cancer. But apart from mouth and throat cancer, HPV can also cause penile and anal cancer. So there are thousands of strains of HPV, and some cause cancer, and others can also cause genital warts. So both genital warts can be found in men and women as well. Now, the thing with genital warts is obviously it's not cancer, so it wouldn't be considered as severe, but it can be treated. You know, it's usually visually unappealing and sometimes very uncomfortable, but for the most part, the genital warts, if, for example, a person is exposed to the strain that causes genital warts, can be treated. Now, with the thing with if a person gets cancer, then unfortunately they will have to go through matters that are completely different from genital warts. So in the sense with HPV, it's a little bit different from other sexually transmitted infections in the fact that there are no symptoms and there are no signs. So whereas other sexually transmitted infections, sometimes you may have uncomfortability, for example, while urinating, or maybe some irritation. With HPV, there are no signs or symptoms. So unfortunately, if an adolescent contracts HPV, for example, at the age of 17, usually they can go years and years without even knowing it. And unfortunately, they probably won't find out until they get a diagnosis, perhaps in their late 20s or in their late 30s, or if they get an abnormal pap smear. So that's usually when a person finds out they have HPV. Now, HPV, because there are no signs and symptoms, a lot of people are concerned about that because they don't know what to do once they get the diagnosis, or they ask themselves how they could have prevented it. And we will talk about the prevention method in a few slides following. So is there a cure for HPV? So unfortunately, there is no cure for HPV itself, right? One thing that I do like to talk about with parents though, however, is being able to recognize and know the risk factors, what increases your chances of contracting or your adolescent themselves contracting HPV. So one of those are by having 16 or more vaginal or oral sex partners. So being a little bit, more promiscuous and not taking the protective measures such as using a condom while being sexually active can increase your risk. Two, people among their late teens and early 20s are at higher risk. And this is also because at that age, adolescents get curious, they start experimenting, and, for other reasons as well. So it's definitely important to make sure that you are aware that even though these are some risk factors, there are preventive measures to take. So there is a vaccine that prevents HPV-related cancers, and it is over 90% effective. So the vaccine itself came out in 2006. So we're in 2020. That makes it about 14 years, right? And the first vaccine that they came out with was the bivalent. And that's pretty much just a fancy name for saying that it offered protection against the two strains of HPV. So again, there are thousands of strains, but the bivalent offered protection against the two most common. The following one was quadrivalent, and that means that it offered protection against four strains. And the one that we are currently using, the 9-valent, or if you're more familiar with or if you heard of, it will be the Gardasil 9. So that pretty much means that it offers protection against the 9 most common strains that causes genital, cervical, oral, and oral cancers as well. Okay, so let's talk a little bit about the recommended number of doses and dosing schedule for HPV vaccine. All right, so the vaccine is available for adolescents beginning as early as age 9 and up to the age of 26, right? So before I even talk a little bit about the recommended doses, I would also like to mention that even though the vaccine is available from 9 through 26, it is available for adults to the age of 45 as well as approved. However, it's not necessarily recommended for anyone after 26, one, because of exposure. As you get older, the likelihood of a person having been sexually active has already increased, and most likely they have already been sexually active. So because the vaccine is a prevention method, you want to give your adolescent the vaccine before they're exposed. So a person who's older than 26 or up to 45, most likely at that point in their life, they have already been exposed to one or many of the strains that exist for HPV. So 9 through 26 is usually the time frame in which adolescents are getting the HPV vaccine. More importantly, as early as 9 is the best time to get your adolescent vaccinated. Usually doctors are offering the vaccine between 11 and 12, but as public health officials, nurses, and just giving out more education to parents like yourselves or anyone who else is on this webinar, we're urging that as early as possible is the best, right? You want to make sure you vaccinate your adolescent before they're exposed, before they have any type of sexual contact or any type of sexual experience, because then the body would already know once that time comes and they are sexually active that they're protected against the HPV strains that they may be exposed to at that time. So with that said, the initiation of vaccination is most important. So basically what that means, if your adolescent hasn't got vaccinated yet and your adolescent is less than 15 years or younger, then that adolescent requires a total of 2 doses, right? So again, requires a total of 2 doses. The first one, when you get at the first visit, and then 6 to 12 months, your child will receive the second dose. If your adolescent is older than 15 years old, then they would receive a total of 3 doses. They'll get their first one at the first appointment, 1 to 2 months after, they'll get their second, and then 6 months, they'll get their third, right? One important thing to know about the vaccination schedule for HPV is that it provides long-lasting protection as long as the adolescent gets a complete as long as the adolescent completes their series. So if they're younger than 15 years old, if they get both of their 2 doses, they don't have to worry about a booster shot. And that goes the same for an adolescent who's 15 years or older. If they get all 3 of their doses, they don't have to worry about a booster shot. So with some vaccines, as the one we will be talking about next, sometimes it requires a booster shot because it may decline in its immune response. But with the HPV, it provides long-lasting protection. So you won't have to worry about your child getting another shot in 10 years or in 20 years. They're protected for a long time. Okay. Another thing that I like to mention to parents, just so that they have a full understanding of why this vaccine is very important, right? Here in New Jersey, our rates aren't as high as we would like it to be. So just to kind of have you understand that 53.8% of female adolescents aged 13 to 17 are up to date with their vaccination. 45.5% of male adolescents aged 13 to 17 are up to date with their vaccination. However, the healthy people goal is 80% for both females and males. And so obviously just listening to those numbers, you can see that we're not near 80% at all. So we do urge that if your child hasn't been vaccinated yet, that they get vaccinated as soon as possible. Another thing that I almost forgot to mention too is if your child, for example, because this comes up a lot when I get questions from parents, if your child happens to get their first vaccination at the age of 13, right? They're younger than 15, they require two. And for whatever reason, you can't get them back into the hospital, you can't get an appointment, or life just happens and you just aren't able to get to that second vaccine within the 6 to 12 months frame, right? If they come back, for example, when they're 17, they still only need one more dosage to so that it's considered complete. Why? Because they initiated again before they were 15 years old. All right, so that's an important key thing to know about the vaccination. You're always going to need two doses. If you're younger than 15, older than 15, you're always going to need three doses. Okay, so now we are going to have everyone here. I have a poll question for everyone who's on. And the poll question says, for children who get their first dose of HPV vaccine before 15, how many shots do they need for the HPV vaccine to be effective? And so our choices are 3, 2, 1. And I'm going to give everyone a few seconds to choose a response. And so there's only one correct answer. So about half of the people voted. I'm going to give it a few more seconds just to give everyone the opportunity to put in their responses. Okay. So one more time, for children who get their first dose of HPV vaccine before 15, how many shots do they need for HPV vaccine to be effective? 3, 2, or 1? So we have 50% voted. I'm just trying to get the few people who haven't decided. Okay, so I'm going to close the poll. Okay, so we have, for children who get their first dose of HPV vaccine before 15, how many shots do they need for the HPV vaccine to be effective? So 13% said 3, 80% said 2, and 7% said 1. So the correct answer is 2. So again, if the adolescent initiates the vaccine before 15, they require 2. If they initiate after 15, they require 3. All right, and I would like to thank everyone who was able to get their responses in. Okay. And now we're going to move on to meningococcal disease. So what is meningococcal disease? Meningococcal disease refers to any illness caused by bacteria called Neisseria meningitis, also known as meningococcus. So these are some fancy terms, but just to kind of simplify it a little bit for everyone, meningitis pretty much means infection of the brain and spinal cord, and meningococcal means a bloodstream infection, right? And so this bacteria generally causes and is spread through the exchange of respiratory and throat secretions like saliva. So, for example, kissing can be one of those incidences where you have those respiratory or throat secretions exchanged between two adolescents, and usually that's what may increase their chances of getting meningococcal disease, right? Meningococcal disease is life-threatening if especially if the adolescent is not vaccinated or was not vaccinated, right? So this is why this is also a very important vaccine to talk about. It is part of the routine childhood immunization schedule. So this is something that most children would generally get eventually, but also just to kind of give you more information about this so that way that everyone is understands why it's important to know about meningococcal disease. All right, so signs and symptoms of meningococcal disease, right? So unlike HPV, with meningococcal disease, there are some signs and symptoms that you can look out for as a parent or just as a caregiver in the care of adolescent or a child, right? Fever, headache, stiff neck, nausea, vomiting, photophobia, which is sensitivity to light, confusion, and rash, right? So if you see that your adolescent or child is exhibiting any of these symptoms, right, they can be confused with some other diseases, even sometimes the flu, because some of them overlap. However, if you see any of these symptoms, regardless of whether you know what it is or whether you don't know what it is or you're unsure, right, definitely definitely make it your business to contact your clinician or to definitely contact the ER and get your adolescent in so that way that they can be taken care of as soon as possible because again meningococcal disease can be life threatening in within just hours of exposure, right? Another thing that I would also like to mention is that because meningococcal disease does increase as a child gets their chances of exposure increases as the child is older for different reasons that we'll discuss in later slides. You also want to talk to your adolescent about making sure that they understand what the signs and symptoms for meningococcal disease are. So if they feel or if they are exhibiting any of these symptoms themselves and they're not at home with you currently or in the moment, if they're at college or if they're just away at school, making sure that they understand that if they can contact the nurse or if they can contact their health provider or anyone who is who can help them, then they definitely should be able to know these signs as well for themselves, so that way they can also make sure they get the care that they need at the moment. All right. So how is meningococcal disease treated? Meningococcal disease is treated with antibiotics. However, there is a vaccine that can prevent meningitis. So there are two types of meningococcal typically that are licensed here in the United States, and that includes the meningococcal conjugate vaccine, which is also known as MenACWY, and serogroup meningococcal vaccine, which is known as MenB, right? All 11 to 12-year-olds should get a men's ACWY vaccine and a booster usually between the ages of 16 through 18. Now, for the meningococcal vaccine or the meningococcal conjugate vaccine or MenACWY, there are typically two vaccines that are available, but for both of those, clinicians usually give two doses to preteens and teens. And it helps protect against four types of bacteria that cause meningococcal disease, right? And those are the serogroups A, C, W, and Y, right? Serogroup pretty much just means a group of related bacteria. For meningococcal disease, there are a total of six pretty much strains, right? And those are A, B, C, W, X, and Y. So for the first one, it offers protection against four out of those six, which again are A, C, W, and Y. Now for the men B vaccine, there are 2 vaccines that are available, and those are usually also given in 2-dose series to people between ages 16 and 18. And that helps protect against serogroup B meningococcal disease. All right. So again, preferably at the ages of 16 through 18. Okay, so now let's talk about the safety and effectiveness for meningococcal vaccines. So meningococcal vaccines are very safe and they're effective at preventing meningococcal disease. So one thing that I do want to mention, which is very important to also know, is that even though the vaccines help protect against meningococcal vaccines, um, they cannot prevent all cases, right? So there are sometimes cases where even if an adolescent is vaccinated, sometimes they can still get meningococcal disease, right? Men ACWY and men B vaccines produce immune response, which suggests and provides protection. However, this protection decreases in many teens within 5 years, right? So unfortunately, um, from 11 to 12, if they get their vaccines, that is why the booster B shot is critical to maintain protection, right? Because if you get that booster shot, then the immune response is going to increase, and then they offer new pretty much protection again, because it does decrease over time from the first couple of doses you get in the beginning, which is why 16 and 18 are important time for them to get that booster shot. So unlike the HPV, which is long lasting and you only don't need a booster shot, with the meningococcal B vaccine, you do need one. And it is recommended that they get that between 16 and 18. So if you're here on this webinar today, you have an adolescent who is 16 through 18 and hasn't got their booster shot, then I definitely recommend that you speak to your clinician or your provider as soon as possible to make an appointment so they can get that vaccine. All right. The most common side effects with meningococcal vaccines are mild. So like they'll probably experience a sore arm or for example, just, a lightheadedness. And these are side effects that adolescents or anyone who gets any type of vaccine may experience. So it's not something that's going to be unusual. It's usually sometimes expected that they get some light common some side effects. But again, if an adolescent gets any of these vaccines, whether it's the HPV or whether it's a meningococcal B vaccine, experiencing some of these side effects is not abnormal. So it's just something you definitely want to look out for. And if they do experience it, speak to the provider who is administering the vaccine so that way they can take a look and take the proper measures to kind of ease that the pain that they're probably going through at the moment. Again, and these side effects usually don't last any more than 1 or 2 days. Okay. So now we're going to go to our second poll question just to make sure everyone is understanding. All right, true or false? Can you spread meningococcal disease by having close contact with someone, such as by touching or hugging them? So I'm going to give about a minute or two for everyone to choose a response, whether true or false. All right, so we got almost half of our responses. I'm going to give a few more seconds so that everyone has the opportunity to respond. Okay. All right, so I'm going to get ready to close the poll for those who are a little hesitant or still undecisive about which answer to choose. So it's either So again, true or false, you can spread meningococcal disease by having close contact with someone, such as by touching or hugging them. True or false? Okay. Okay. So the answer is false. So you cannot spread meningococcal disease by having close contact with someone, such as by touching or hugging them, right? So remember that the only way that you can spread meningococcal disease is by respiratory secretions or through saliva secretions, right? So, or throat secretions, sorry, which includes saliva. So again, an example of that would probably be kissing or anything that involves exchange of those saliva or any of those fluids, right? So hugging and touching is okay. Mm, mm, perfectly okay to do. All right. So with that said, I'm going to pass over the presentation to Kendra, who would continue.
Hey, hi everyone. So this portion of the presentation, I will be presenting about flu and Tdap. So we often hear about flu, the importance of getting the flu vaccine. The flu season comes around every year, so we already know that. But the question here is, what is flu and why it is important to get vaccinated, right? So as you can see here, the flu is a contagious respiratory illness caused by influenza viruses that affect the nose, the throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. But also to let you all know, as many as 49 million people get sick with the flu each year. And so the flu virus are one of the most common causes of respiratory infections in people of all ages, and often occur as outbreaks during winter months. But unlike many other viral respiratory infections, for example, common cold, the flu can cause illness and life-threatening complications in people. So that's why it's extremely important to prevent from getting the flu is to get a flu vaccine each year. So how is the flu spread? So the flu can be spread two ways. It can be spread from person to person, or it can be spread from touching a surface or object that has the flu virus on it. So if you are near someone that is coughing, sneezing, or talking, what's happening is they're sending droplets of the virus into the air. And of course, if you're nearby, it's going to go into to the mouth or to the nose. One of the things that we are doing right now, we are practicing social distancing, something that we're already doing due to COVID. And as we're getting ready to approach flu season, we want to continue to practice that. We also want to make sure that we keep our distance from people that have the flu to prevent from them spreading the flu onto you, or if you have the flu, socially distance yourself from spreading the flu to other people. As I mentioned too, getting the flu, you can also get it from touching surfaces and objects. It could be a doorknob, it can be your desk. But something that we don't realize that we do often is we touch our face. So we're touching our mouth, we're touching our nose, and we're touching our eyes without even realizing that we're doing it. Another thing that I want you to continue to practice, especially your kids, is to practice hygiene, such as keeping your hands clean and avoid shaking people's hand, especially those who are sick. We want to continue to be regularly washing our hands and using that 15 to 20-second rule. Why? Because this removes the viruses. And also, as we've been doing before, hand sanitizing, keeping a bottle of hand sanitizer in your bag. So we already have all these things into place. We already been doing this practice for the last couple of months due to COVID. We want to continue to practice this as we enter into the months of flu season soon. So here are some common signs and symptoms of flu. There's fever, cough, sore throat, runny, stuffy nose, muscle or body aches, and headaches. Believe it or not, I have met people before who've mentioned that they've had the flu and they've gotten over the flu in a couple of days. Where I've met other people who've said I had the flu and I've had it for 2 weeks and I was in so much pain and I've had headaches. But there are people who are infected with the flu and may display no symptoms at all, and they can also experience mild or moderate symptoms, and in some cases, severe symptoms. So everyone's experience with the flu is different. And flu can feel very much like colds, but sometimes tend to be more severe and come on faster. So they have flu treatments that is often given to people that have the flu, right? Antiviral drugs is an option, right? And what that does, it can lessen symptoms and shorten the time that you're sick by 1 to 2 days. And it also can prevent serious complications like pneumonia. But what I also want to let you all know is that this is not the antiviral drugs are not a substitute for getting a flu vaccine. I want you to keep in mind that the flu vaccine is the best way to prevent influenza. And, I often hear people say, oh, I've gotten the flu vaccine last year. I don't need to get the flu vaccine again this year. Or, they have their own reasons as to why they don't need to get the flu vaccine. But I'll go into more of that as I continue to present. But again, these antiviral drugs isn't a replacement of getting the flu vaccine. Okay, so it's the best way to prevent from getting the influenza is getting the flu vaccine. So who should get a flu vaccine? So everyone 6 months of age older should get a flu vaccine. The flu vaccine is recommended for the use of pregnant women, people who have chronic health conditions, and important for people who had high risk of serious complications from influenza. So each year, there tends to be a new strain of the flu virus that affects people, and even those who have been sick with the flu before are vulnerable to the infection with the new strain, which is why, it's emphasized or stressed the importance of getting this vaccine every year. So as you know that there's a new strain of the flu virus, and even though you've been, exposed to the virus prior, you're still vulnerable to the infection with the new strain. And also to let you know that, each year as many as 960,000 hospitalization and up to 79,000 deaths occur in the US from flu-related complications. So we want to continue to stress today the importance of the vaccination, getting this flu vaccine. It is, again, recommended for six months of age and older, people with chronic health conditions, pregnant women, and those who have who are at high risk of serious complications from influenza. So for the flu vaccine, why is this flu vaccine important? Right, coming back to that. One, getting vaccinated reduces the risk of all flu illnesses, hospitalizations, and even the risk of flu-related death. I often get this question when educating to parents, is the flu vaccine safe? Did a presentation a couple of months ago, and that was one of the questions that the parents asked: is the flu vaccine safe? Because I went online and I've read information about the flu vaccine, and I don't know too much about it. And I have never gotten the flu vaccine before, so I don't know if I should get my kids vaccinated. Well, as you can see here, the flu vaccine have a good safety record, and hundreds of millions of Americans have safely received the flu vaccines over the past 50 years. And there has been extensive research supporting the safety of flu vaccines. Before any vaccine goes out into the market, they make sure they do extensive testing before they administer the vaccine. So as you can see, it is safe, it is effective, and of course, I always say this: if you have any questions about, the vaccines that we are presenting to you all today, speak to your healthcare provider. They will be able to provide you with all of the answers to your questions and address any concerns that you have. Because I always tell parents, I prefer to know that your child is vaccinated to prevent against these diseases that could potentially, harm them or, can, be severe and that can lead to death, than to know that they didn't get vaccinated at all. So the goal here is to make sure that they are vaccinated from these diseases that could potentially, again, cause death or cause harm to them in their bodies. So now we're going to go into our next poll question. And the poll question is, true or false, you need a flu shot every flu season? So the question is, true or false, you need a flu shot every season? We'll give you a few minutes to answer that. Okay. A few more minutes. Okay. And I guess we could share the response now. If everyone is done, yeah. And that's correct. You do need a flu shot every year and every season, and that's true. 90% said true, 10% said false. And remember, as I mentioned earlier in the slide, that excuse me, every year tends to be a new strain of the flu virus, and so it's recommended that you get the flu vaccine every year to protect you from getting the flu virus. Okay, so we can move on to the next slide. And so this presentation here, I'll be talking about Tdap. Tdap is, the Tdap vaccine is also one of the vaccines that is recommended along with the meningococcal vaccine for schools, for adolescents. But you'll also learn in this slide that the Tdap vaccine is not only given to adolescents, but it's also given to pregnant women and adults. So what does Tdap stand for? Tdap stands for tetanus, diphtheria, pertussis. Tetanus causes painful stiffening of muscles. It can lead to serious health problems, including being unable to open your mouth, having trouble swallowing, breathing, or even death. The diphtheria, it can lead to difficult breathing, heart failure, paralysis, or death. And for pertussis, it's also known as whooping cough, which can cause uncontrollable violent coughing, which makes it hard to breathe, eat, or drink. It can be serious in babies, young children, causing pneumonia, convulsion, brain damage. It's also serious in teens and adults. It can cause weight loss, loss of bladder control, passing out, rib fracture from severe coughing. So as you can see, that Tdap, diphtheria, and pertussis are very dangerous and life-threatening diseases. So who should get a Tdap vaccine? So as mentioned, the Tdap vaccine is not only given to adults, but also given to pregnant women. I'm sorry, Tdap vaccine not only given to adolescents, but it's also given to pregnant women and adults. So the vaccine can be given to adolescents 7 years of age and older, so roughly around the ages of between 11 and 12 during their adolescent wellness check for school. For pregnant women, a dose of Tdap should be also given during every pregnancy to protect them and their newborn from pertussis. And usually when a pregnant woman is given the Tdap vaccine, it's normally during their 3rd trimester, so optimal timing between 27 and 36 weeks. Adults are also given a Tdap dose, which is received as a booster dose every 10 years. So as I mentioned before, the Tdap vaccine is not only given to adolescents, but it's also given to pregnant women during their 3rd trimester, and also adults receive this vaccine every 10 years as a booster shot. So how is this spread? It is spread from diphtheria, and pertussis is spread from person to person, and tetanus enters the body through cuts and wounds. So here are some common side effects of Tdap: redness or swelling in the arm, mild fever, headache, upset stomach, including nausea, vomiting, and diarrhea, muscle aches and pains. And just like every vaccine comes with a chance of side effects, the side effects with Tdap are generally mild and they go away on their own. And as Melinda mentioned earlier, it's best to know, it's best that your adolescent know the signs of and effects of, these types of symptoms, just in case if it was to become severe, they know that they can be well taken care of. Okay, but usually the side effects for Tdap, they're generally mild and they go away on their own. So again, what is the safety and effectiveness of the Tdap vaccines? So, the safety and effectiveness of the Tdap vaccine and all of the vaccine that we mentioned today. All of these vaccines that are used in the United States are required to go through extensive safety testing before they're licensed by the FDA. So the Tdap vaccines it's just as safe and effective in preventing diphtheria, tetanus, and pertussis. Vaccines, like any medicine, can have side effects. And the most common side effects are usually mild and they go away on their own, as I mentioned before. And again, once a vaccine is in use, it is monitored for safety and effectiveness. So, again, as I mentioned, before putting any type of vaccine out on the market and before they're administering it to anyone, they just make sure that they check for the safetyness and the effectiveness of the vaccine. I often tell parents, when they address their concerns and they have questions about these vaccines and why they don't want to get their kids vaccinated, I said, advocate for yourselves and ask questions before leaving your provider office. Talk to your provider and let them know the kind of questions that you have, the concerns that you have, because they're the reason, they're there for that reason. They're there to answer the questions, address these concerns, and provide you with additional educational materials that, you can go home and read on your own as well. And again, the goal is to prevent your child from being exposed to these viruses. So we want to make sure that, they are vaccinated and they receive the school required vaccines and the flu vaccine as well as the HPV vaccine. So again, I am an advocate for just speaking to your providers about the questions that you have, because without address the questions, what happens is we go online and we find all of this information, and there's misinformation and misconception about the vaccines, and then you're hesitant about getting your kids vaccinated. So definitely speak up and, speak to your provider about the questions that you have. So now we're going to go into our last poll question. And the question is, true or false? The Tdap vaccine is only given to adolescents. True or false? The Tdap vaccine is only given to adolescents. So we'll just give it a few more minutes. Okay, a few more minutes again. All right, Melinda, whenever you're ready, you could show the answer. Yeah. So that's correct. 82% answered false. The Tdap vaccine is not only given to adolescents, because remember, as I mentioned in the slides, it's also given to women, pregnant women during their third trimester, and it's also given to adults as a dose is given to adults every 10 years as a booster shot. So again, we just really hope that you, this is coming towards the ending of the presentation. We really hope that you, enjoyed this portion of the presentation, and which leads us to our last slide. So this slide here talks about the VFC program. If you have never heard about the VFC program, it's called the Vaccine for Children program. And the Vaccine for Children program is for children who is younger than the age of 19 years of age, Medicaid eligible, uninsured, and underinsured. And the purpose of this program is to be able to reassure that these children have the opportunity to get the vaccines that they need. So one of the things, oftentimes people ask me, well, how can I get involved with this program? Well, first you want to make sure that your provider is a part of the VFC program. That's one. And two, I often get the question is, where can I get my kids vaccinated? So they can get vaccinated, they can get this vaccine, can be provided at a local health clinic or any of the vaccines that are mentioned today. The vaccine can be given at federally qualified health centers or rural health clinics. We have them in the area, such as Irvington and Newark, Jersey City. We have a couple of federal qualified health clinics, and usually these health clinics, they are part of the VFC program. And lastly, as I mentioned earlier, if you have any questions about getting your child vaccinated, ask your healthcare provider. I can't stress that enough, because I prefer you to have the right information and walk away with valuable information and educational resources than to be hesitant and not get your kids vaccinated at all. And then here is just the resource page where we were able to, get some of our information. And you can also go to some of these websites to get information as well, based off the information that we provided today. The vaccines that we talked about, the CDC, Immunization Action Coalition, New Jersey Department of Health, as well as the Protect Me 3+ website.
Okay, thank you, Kendra. As we come to a close for the presentation before we actually end the broadcast, just to kind of reiterate or add on to the resources, here are some references that you can also look at just in case you want any more information on any of the vaccines that were spoken about today. I'm also going to use this time to open up questions if anyone has any on any of the vaccines that were discussed today. So if you have any questions on HPV, on Tdap, on meningococcal disease, please feel free to ask your question now, and we're gonna actually give a few minutes for anybody to type in those questions, and we're gonna answer as many as possible. So we'll utilize this time to have everyone ask their questions. And please feel free, ask any question. If you have any doubt about anything or if you wasn't clear on anything, now is the time. Okay. So we're getting a couple of thank yous. You are welcome for all the information that was provided today. I hope that everybody was able to follow and able to have any questions that they had prior answered. Again, if you need any clarifications on any of the vaccines, and you also would type in the question into the question box. So if you see there where it says questions, that's where you type it in and then you can send it. Okay, we have a question here. Is Neisseria part of our normal flora? That is a good question. Yes, this bacteria is found sometimes in the back of our throat. So you do have a couple of it found normally in you, but sometimes, you may get an accumulation of it and then it causes a negative effect. But there are, according to studies that some people do have it in their normal flora or just generally in their body. So, and this question is referring to meningococcal disease, if anyone is wondering. So that's referring to the Neisseria bacteria for meningococcal disease, the bacteria that causes meningococcal disease. Okay, so we have another question here. Which of these adolescent vaccines are required for school? So HPV is unfortunately not required at the moment. We are working hard to make sure that hopefully in the future that it is required, because again, it is a common sexually transmitted infection. It's seen in a lot of late teens and older adults, 20 years age. So we're hoping that in the future it will be required, but for HPV, no, it is not required. Meningococcal disease, it is required. Again, it's a part of the childhood immunization schedule, so that one is required, and that one is usually given at 11 and 12 years old, the booster shot at 16. So that's something that's definitely going to be required for that adolescent. And Kendra, if you want to mention the two that you spoke about.
Yes. So Tdap is also one of the required school vaccines along with the meningococcal vaccine. They do offer and bundle when recommending it to the parents, both Tdap, HPV, and meningococcal. But the two required vaccines are Tdap and meningococcal. We also do stress flu because we see the importance of getting the flu vaccine. But to your question, just Tdap and meningococcal are the required vaccines.
Okay. All right, we'll give it a minute just in case anyone has any other questions. All right, so it doesn't seem like we have any more incoming questions. If you do have any other questions in the end, we'll address those. Well, Kendra will let you know how you can address those questions to us. But I would like to thank everyone for their participation in answering the poll questions, as well as anyone who submitted any questions in the question box just now. So thank you again. Okay.
And lastly, our contact information, both Melinda and I. As of right now, you can reach us via email. If you have questions that you weren't able to, you didn't think of right now, but it came up later on, you could definitely shoot us an email. If you're interested in educational resources, please let us know. Email would be the best way to contact us at the moment, and we will provide you with any additional resources that you may need. But I just want to thank you all again for taking part in the webinar. We really hope that you receive the information was well received. And please feel free to reach out to us anytime with any questions and concerns that you may have. Thank you again so much for your time.
Okay, thank you. And with that, I would like to formally end the broadcast. And I hope everybody stays cool in this heat and enjoys the weather and have a great day.